Okay, thanks again.
Thank you.
Okay, so now the second session starts, and it's remarkable that we have 4 speakers from startups and companies, right? So that tells us something, that maybe this kind of innovation is really brought forward by industry. The first speaker of the second session is from crypto coin. Many of you do know and do associate with blockchain applications in healthcare, and that's TJ from MediBlock. And there he is already. Okay, I was just about to tell you that he couldn't join in person today. He's in South Korea. I think it's quite late there. You're 9 hours ahead, right? So thanks a lot for staying awake. And the stage is yours.
Great. First of all, thank you, Peter, for introducing me. Hello, everyone. My name is TJ, and I'm a product owner at MediBlock. It is our honor and my honor to participate in this conference today. Like Peter mentioned, it's midnight over here, so my wife is asleep, so I might speak a little softer than usual. So if it ever gets too soft, let me know somehow so that I can raise my voice a little bit more. Also, thanks, Professor Prince. I think that was a remarkable keynote about blockchain technology overview. I think in my presentation, I'm not really going to go too deep on the technological side of the blockchain, but we'll mention some features that Professor Prince just mentioned as well. One last thing is that we have just decided that we will be visiting Berlin in November. So if anyone wants to come to Berlin in November during the Blockchain Expo, that's happening in November 23rd and 4th. It'll be really nice to see you all there in person. Yeah, so today I'm going to talk about patient-centric health data exchange with blockchain that MediBlock is creating. Okay, and so the agenda for today is talk about myself a little bit, and talk about what MediBlock is building, and then talk about what MediBlock is going to build next. So about myself for a little bit, I started my career as a relationship associate at Citibank here in Korea. I worked for 3 years, and then I found out that I was a little bit sick and everything, so I got interested in healthcare IT, moved to MediBlock as a business development manager. While I was working at MediBlock, I found out that I had passion for product managing in the IT industry. So went to a Kakao Bank, which is the first internet-only bank here in Korea. Has about a lot of users here in Korea, and actually came back to MediBlock about 7 months ago, and now I'm working at a product owner in the blockchain team. And that is not my whole story. The interesting story is that I'm a patient of Crohn's disease. While I was working at Citibank, I felt the sharp pain in my stomach, and then I was losing weight, and then I was going anemic, and realized that I had to actually get checked up, and went to a hospital. I mean, I suffered from stomach pain for a little bit while I was studying in the United States, but couldn't find what was wrong with me. But finally found out that I had Crohn's disease after 7 years of suffering with the pain. Currently, I'm very healthy, so you don't have to worry about me. But let's just go a bit more into this story. The reason it took me 7 years is because I had to go through testing over and over and over again. I mean, it happened because I was traveling between US and Korea, but even while I was in Korea, I could not really take my data from the hospital and go to another hospital and say that this is my data, because all the doctors were not really trusting the other hospital's data, or the fact that I brought my data in. And the hospitals in the United States weren't really trusting the data from the test data from Korea that I brought. So what I had to do was, each time I go to a hospital or a clinic, I had to go through the same set of tests: endoscopy, colonoscopy, and then if I go to hospital C, I would have to go through endoscopy, colonoscopy, and the CT and MRI. So it took me a total of 7 years to find out, to get to enteroscope, which was examining my small intestine, and got me wondering, why did it have to take this long? Like, if I could have had my data, or had a platform that could easily store my data, and then actually let me share my data to a person in a secure way, and also in a trusting way, it could probably have shortened the time of my suffering, and then let me find out about my disease a little sooner. And that's when I found out about MediBlock. MediBlock's mission is to open up infinite possibilities of healthcare data. And how it does it is by establishing a patient-centric health data platform that utilizes health data. And this, in essence, is the true form of my data in healthcare in our vision. So what we do in order to fulfill this mission, we're building a system that enables individuals to securely store and manage their health data and information collected throughout their lifetime. So what we do is we use blockchain to securely manage and transfer your data from one end to another. And we also create other softwares that go along with the blockchain, so that people can safely manage their data. And also in the hospital setting, they can make a data that could be actually transferable to another hospital. We do this by putting the hash value, which I think Professor Prince mentioned in his presentation, on the blockchain. Like he said, blockchain is immutable, and hash value is like a fingerprint of the data. So when we put the hash value on the blockchain, it's like stamping that data's fingerprint onto the blockchain, so that when it travels through any medium, the recipient could check back with the blockchain and actually see if the fingerprints are matching. Just to explain a little bit more about the hash value, like we said, it's the fingerprint of the data. So if any length of the input, when it goes through the hash function, it comes out to be the fixed length. And if the data is different, it'll create a different hash. But it could be same, but very, very rarely. Like in actual fingerprints, there is a chance of two people's fingerprint being exactly matching, but it's highly unlikely. And one other feature of the hash value is that even a very small change will result in a completely different hash. So what I'm trying to tell you is that it is very hard to have two data to have a same hash, so that this model actually works pretty well when we are actually dealing with data integrity. So in creating this system, we're building 3 products. One is we call it PHR, and then the name of our product is MediPass. This is for the patient side, where patients can store their data and then actually utilize their health data whenever they want to. In in making their insurance claims or collecting their health data, so on and so forth. Currently, we have about more than 300,000 users for this app here in Korea. And the other product that we're building is Dr. Palette. This is the EHR solution where it's used in clinics for doctors to actually store and write the symptoms and prescriptions for the patients. And when our user from Medipass visit the clinic clinic that's using Dr. Palette, they can make reservation or they can request data to be downloaded to their app, so on and so forth. And in the middle of all this is our blockchain panacea that helps the data circulation. So whenever that data transfers from one place to another, it stores the hash value on the blockchain so that the data's integrity could be maintained anywhere it gets used. We have a lot of partners here in Korea. We have about 10 hospitals that's already being linked with us, and also about 12 or more clinics that's being linked with us. And also we have conducted a infectious disease monitoring pilot with Bill and Melinda Gates Foundation here in Korea, and also with KT, which stands for Korea Telecom, that is one of the biggest telecommunication company here in Korea. Now it's an interesting part. It's where we see some things that's not working really well for us. So, like I said, we are using Medipass as a PHR solution where the patients can actually download their data and then use their data whenever they want to. And analyzing the data that's being flowed into this Medipass and then being actually used, we see that people are really loving this easy claim service that could help patients make the insurance claim in less than 10 seconds only by clicking some buttons without typing anything or without having to take any photos or whatnot. So we see that the number of claims that's being made every week increased from about 100 to 5,000 in a couple of months. However, the other service that we thought was going to be very interesting for everyone was data gathering service, where we let our users gather their national health checkup data or vaccination history. But this service was not really growing too well. And we were thinking about a couple of reasons why this was not happening. This was not increasing. And we found two problems in our analysis. First was the absence of trust. People were keen to managing their health data, but were also very afraid of managing that data with an IT system because they have experienced or heard about failures due to a centralized model. I don't know about you guys, but in Korea, there was a huge article about how the Singaporean government were breached and their prime minister's health data were hacked. And also there was a case about Blue Button, which happened in United States. And actually Koreans did a survey whether they want to share their medical data with someone else or institution or an IT company, and about 67% were opposed to sharing their medical data whatsoever. So we thought that was the first problem that was happening. And then the second problem was that people really lacked the incentive to actually gather data. So mere managing and storing health data was not attractive for our users. If they could have obtained any sense of health promoting activity from gathering the data or any monetary incentive from gathering the data, they were willing to actually do so. But since our service was not offering any of those, but merely managing and showing the data to the personnel, they were not really keen on gathering their data. But that was very important for us, because we thought by providing the service to our users, we could start thinking about them using their data and then and provide the data to institutions, research institutions, or insurance companies, or pharmaceutical companies, so that they can use those data and actually do more business with those insurance companies or research companies directly. So we thought we needed to come up with a new model to solve this problem. And that's when we decided to develop this protocol called a data exchange protocol. We call this DEP. And this is a protocol that allows data provider like our users and data consumers like research companies, insurance companies, pharmaceuticals, or ourselves, ourselves meaning MediBlock, to safely exchange this data between the two with our main net called Panacea and our coin and our cryptocurrency, MED. And this protocol lets the data consumer and data provider use our blockchain to safely transact their data without actually revealing any of the data on the blockchain, but also use our cryptocurrency as an incentive for providing that medical data to the data consumer. There are three core strengths of this data exchange protocol. First is trustless. There is no need to create trust between the parties, which means that data provider do not have to trust the data seller, or data seller do not have to trust data provider, but only trust the actual blockchain that contains all the information about the data, or that could actually check the data's integrity and validity only through the protocol. And also the second strength is that it is privacy preserving. Like I said, we're not going to store any of the medical data itself on the blockchain, but rather we have designed I didn't mention this before, but we have designed a decentralized oracle that will help checking the integrity and the validity of the data off chain. So we're not putting any sensitive information on the blockchain, but at the same time could check the validity and the integrity of the data. So the second strength is the privacy preserving part. And the third part is data sovereignty. So if the data provider does not wish to engage in any transaction, any data transaction, they don't have to. But for only for the people who are interested in claiming those incentives, they can make the decision to provide that data to the data consumer. So we think this is a protocol that highlights and redeems the strengths and weaknesses of blockchain technology. With DEP, our ultimate goal is to have data consumers, such as insurance or pharmaceutical CROs, to communicate and exchange data directly with data providers using blockchain. This means that the actual institutions to be linked with our blockchain directly and integrated with our blockchain with APIs or with their servers or whatnot, and actually and do communication with our data providers, such as our users or any other healthcare IT service users that are on our blockchain, to actually do the deals between the two. And that is our goal. Our goal is to make a protocol that can treat this kind of transactions between the two. But given that the institution's willingness or or technological advancement is not happening at the rate that we would like them to happen, what we have decided is that we are going to have a different launching strategy where we become the first data consumer of the data provider of our users, and we could be like an intermediary that does the business, that does the managing for our users. So we would be the first buyer of the data, first consumer of the data of our users. And with those provided data, we will be using those data to upgrade and sophisticate our service, but also do data platform business with pharma and insurance, and do target ad or marketing campaigns with our hospitals, pharmacies, CROs. And when we make profit from this kind of activity, we will be sharing those profits back with our users, so that users can benefit from gathering the data from our app. And we believe that this will help our users actually gather data and promote a very healthy data exchange within our blockchain, and make sure that we as a company to grow our data platform business and then data platform ecosystem with our blockchain. With this, I would like to conclude my presentation and then open up the floor for any questions that you might have. Thank you, everyone.
Yeah, TJ, thanks a lot. So are there questions for TJ? Kirchhoff.
Yes, so first of all, really cool presentation.
Wait, we need to pass you a mic.
So first of all, thanks a lot for this really impressive presentation. We always get, or at least myself, I get jealous when I then see that you already connected 20 hospitals. So I think this shows the scale you already have over there. One issue, because coming back to your initial slide with this patient journey where you had to have the same diagnostic test done over and over again, when we try to address this problem here in Germany, oftentimes it's not so much a question of trust, but rather that data formats, data standards between hospitals, physicians are very different. So I was wondering if you also address this issue of data harmonization and standardization as part of your platform.
Yeah, thanks for the question. You can still hear me, right?
Yes.
Yeah, cool. So that is a great question. We get this question a lot, and then we are actually doing a extensive research on this with Intermountain Healthcare, I believe. And we have decided that we are going to take HL7 Fire format that could easily, yeah, I see the thumbs up, so that's good. That's a good sign, I guess. Yeah, we have decided that we're going to take the HL7 Fire format because we want to make sure that this platform could operate globally. And then we thought HL7 Fire is the most, I think, open and more advanced data exchange format out there. I personally am not a expert on this, but I believe our founders, who are actually doctors and also software engineers, were reviewing it and then decided that we were going to go with it. But just want to make sure that I mentioned this. In Korea, we've experienced that hospitals say that they have already gone HL7 Fire, but they haven't actually gone HL7 Fire, and we see that case a lot. So we think it's going to take a little bit of time for each hospital to convert their data. And then actually there are a lot of companies here in Korea who help hospitals do that. So we hope that it happen within 5 years span, so that health data could be traveled not just around Korea, but also across the globe.
Okay, TJ, what's the cost of a smart contract currently in Panacea?
Great question. We actually do not have a smart contract on our blockchain, but we do have several types of transactions, specific transactions that let people to transact, let people to do their desired transactions. So there is a transaction to send med to a different person. There is a transaction to store hash on the blockchain. There is a transaction to just send any memo on the blockchain, so on and so forth. And each of those transactions cost minimum of 1 MED, which is about 2.20 cents, I believe, or sorry, 2 cents, 2 euros, 2 cents of euros, I believe. That's being cost right now. The reason why we're doing this is because we think that smart contract is something that needs to be more developed before it could be used in a production setting, because it is hard for the users to actually know what to input and know for the general users to utilize it well so that they could make benefits out of it.
Okay, thanks a lot. More questions from the audience. Yeah, Nicolas.
Thanks a lot, TJ. That was really interesting. We've been thinking about similar things as well for rare diseases, specifically rare eye diseases. And I think if you've got motivated patients, they would maybe do that. And as you said, patients, unless there's like a good incentive, they might not do it. So I was just wondering, maybe, sorry if I missed it, but what was the incentive from the hospitals to participate in this?
I think this is a great question. It is very hard to convince the hospitals to actually join our system. But the first case scenario was the first hospital that joined our system was Samsung Hospital here in Korea, which is one of the big 5 hospitals. And they are suffering from the long line of patients waiting in their reception desk to actually gather their data to provide to their insurance companies or whatnot. So what they are fighting for right now is customer service, and they wanted to go digital. So that is why the hospitals are starting to participate in our system, so that they can actually minimize the time that patients have to wait in the line in the reception desk or whatnot, so that they can retrieve their data. And also, this will actually, I think this will take a long time for it to actually happen, but this can actually decrease the cost that they pay in using the human personnel in the reception desks, sitting there all day to just do manual labors that actually provide the hard copies of the data that they want. So did that answer your question? All right.
Still working? Yeah. Okay. Yeah. Answer the question. Thanks.
Okay. Cool.
And am I allowed one last question? Or
yes, because TJ.
If Peter allows.
I make an exception because TJ won't be able to join the panel discussion.
Okay.
So
thank you.
I hope you don't mind that.
It'll be too late for me. So.
Yeah. So what and why? Yeah. So I guess the value of data is a key here, I think, and maybe some hospitals want to, instead sell that data to pharma companies or so on. Yeah. Don't know if that's something you've come across as well.
Yeah, that is something that we are very. That is something that we always keep in mind because without hospitals' help, without hospitals' technical integration to our system, this won't actually happen. And the data is also valuable for the hospitals in doing their own research or in collaborating with insurance companies or, you know, pharmaceutical companies or whatnot. I think there are two aspects to this. First is we believe that this data is patients. So we want to make sure that patients get the fair share of the profit that they can make out of this data. So when we go in talking with the hospitals, we just don't tackle their business model, but we lean more towards the patient's, you know, ease and patient comfortableness or patient's rights, so that the hospitals can actually be more mindful. And when I said be mindful is, I guess, be more thoughtful or be more generous in giving the data that's rightfully patients. So, you know, that is the first part. And the second part is that the data that hospitals can actually handle or are anonymized and very in a very controlled way. But the value of our data is that it can have all the raw data that patients can actually gather. So that is also an interesting take that we have when we talk with the pharmaceutical companies or insurance companies, that our data is more raw, that pharmaceutical companies can actually get the access to that data and then do their own research on their own level. And then I think there's also another factor to this is that the pharmaceutical companies, I met couple globals as well. They were complaining that it takes too long for the hospitals to actually cleanse that data and then actually provide it to them. But the value of our collaborating with us is that it is much faster and easier to actually use that data. So hope that answered your question on that part.
Okay, TJ, thanks a lot for staying up so late, and see you maybe in Berlin in a few months.
Sounds good.
Okay, so the next talk is by David Lazerson.
Thank you, everyone. Bye.
So the next talk is by David Lazerson from Bria, from Israel. He came just a few hours ago, so I appreciate that you made the long journey, and the floor is yours.
Hi. So, hello everyone. I'm David, and I'm the co-founder and CEO at Bria. My professional background is in the fields of cybersecurity, privacy, and data infrastructures. However, in the last several years, I've been lucky to leverage this knowledge at Bria to accelerate healthcare research. Today, we're going to talk about this unusual link of empowering healthcare research with blockchain and how it may solve the challenge of data retrieval and why it is actually a pretty natural fit. The next big thing in healthcare research is data. And although it may sound trivial, the proliferation of research relies on it. Live and secure datasets have been proven to accelerate time to medicine, development of new treatments, providing of required treatment for patients with various diseases. However, data is disconnected, spread among different systems and variety of structures. All current solutions are either degrade data quality or fail to adhere compliance and regulations. Either not fast enough or not secure enough, in general, not enough. This results in years that added to the time of any development of any drug or cure, years that patients are left without proper treatment. This means that some research doesn't happen at all because of resource shortage or incompliance of solutions. However, instead of trying to structure and combine all this data centrally, we may try to embrace the decentralized nature of healthcare data. And then maybe the challenge will not be so big. Centralized and decentralized architectures have been around for decades already. Even for some reason, some nearly religious attitudes towards them. With changing fashions, it could be mainframe versus data centers back then, and then on-premises versus cloud, or SaaS versus blockchain. The fashion's changing. However, both ways of thinking are very reasonable, with advantages and disadvantages, and that depends on the relevant use case. Centralized systems provide efficiency and speed, with a central core that takes care of computation, storage, and maintenance, while the lightweight peers only need to deal with the analysis. This is great, but this structure is unnatural for healthcare data that for years and years and decades have been stored, scattered across many different databases, data stores, a variety of structures and forms. Therefore, it can be extremely difficult to obtain all this data to a central database, and this even not taking into consideration the regulations, the privacy laws, etc., that makes it even harder. By the way, the last thing is a good thing. Healthcare data is one of the most sensitive types of data we can think of, and it may be horrific to think about consequences of a leakage in such a central database. On the other hand, there are the decentralized systems. Their advantages is in being scalable and in keeping the control of the data in the sources, but even more important, that you don't need to take the data anywhere. You don't need to move it anywhere from their sources, and that is what's so aligned with how healthcare data works. So it's possible to build a decentralized application for healthcare data exchange without the need to unify it through a centralized authority. And then only anonymized, compliant data will be shared on demand when the only point of access is the query. Now, blockchain is a specific implementation of the decentralized paradigm, with one of the unique advantages is with the smart contracts mentioned today previously, that allows enforcing rules and guidance on the cryptographic level. So blockchain, in general, can provide scalability, privacy, autonomy, and assurance. In Bria, we implement these features as part of our solutions. Now, Bria is in some ways similar to MedBlock mentioned before. Actually, we are even a bit less of a blockchain system and more of a data transformation and structuring system. So this is about where the main difference is. However, BRIA is a data partnership network designed to accelerate medical innovation. BRIA making the process of obtaining and sharing healthcare data simple and seamless transaction. The outcome is a whole new level of data quality. We call it in BRIA the holy grail of data. It's longitudinal, linked, and live. Our vision is to enable 10 times more researchers, each taking 10 times less time, and each being 10 times cheaper. But two things are important here. One is the quality of data, and two is the compliance. Let's start with the quality side. On the quality side, BRIA's unique approach is that we do not prepare the data in advance. We do not structure data set in advance. We structure and prepare all the data in real time only when there is already a query in place. We are doing it with our adapters that we put in advance. They're doing this translation in real time. This approach provides a 10 times faster time to data, time to integration, 10 times faster than any other solution currently you can find. It provides more precise answers because the answer is always in the context of a specific question without some assumptions that may be done if you prepare the data in advance. And the data is always up to date because it's live. In addition, we have a unique flawless patient matching technology that enables us to match patient records across different sources and provide complete patient journeys without duplication. And we're doing it also thanks to an algorithm enabled by blockchain called zero knowledge proof. It leveraged to create a deterministic matching of records. Eventually, all the data is harmonized in FHIR as well and provided in a unified manner from all the sources to the researcher or to the developer. On the compliance side, we ensure the data retrieval is 100% safe and compliant. We perform bulletproof multi-layered de-identification, and we are the only solution that have an active approach that actively prevents any malicious attempt to re-identify the person, to re-identify the identity. So if a malicious attempt will happen on the network and whoever will try to run a pattern of queries that seems like he's able to re-identify a person, this user will be immediately blocked on the network, and then to re-enable the user, there will be need in the proof of stake. On top of that, we leverage smart contract to enforce all the policies. It starts with regulations like GDPR or HIPAA. It also may be used to enforce patient consent. It's used to enforce specific data use agreement for specific researchers. So that's a whole use of the blockchain smart contracts. Last thing, the whole decentralized architecture validates the data will never go through a third party. And it includes ourselves. There are no such thing as BRIA Cloud or BRIA servers, and no data flows through us. Actually, BRIA as a company doesn't have any access to data at all. Everything is decentralized. All in all, we do the heavy lifting of data preparation and exchange infrastructure in order for researchers to be able to focus on their next medical breakthrough. The flow of the system is as following. Researcher runs a query or an AI model. This query distributes to all the relevant sources, hospitals, etc., executed in each of them separately, and then relevant data is carved and retrieved directly from the sources, structured to FHIR, de-identified, and then transmitted directly to the researcher, where all the data is unified from all the sources. Here is a visualization that shows the process. The standardization of data in the beginning, then matching of tokens with other hospitals, then anonymization, removing of all the identifiers, and finally, the smart contracts that removing from the data all the components that may be out of policy. Here is just another visualization with several hospitals all in once. In the end, it's one query that initiates the whole process. So it all comes to the idea of letting the idea of centralization and actually understanding that in case of healthcare data, maybe make it even more decentralized, but linked by blockchain may be the answer. Here I can give a couple of examples. For example, there is an actual machine learning breast cancer study, clinical study, that following several thousand of patients across about 20 hospitals. So each of the patients may have records in more than one hospital. Some of the patients already developed the disease, some are just carriers of the BRCA gene, some may develop the disease during the clinical trial period. So in order to be able to accomplish this research, you need matched data and match and link data across all these sources, retrospective and prospective, and de-identified. And therefore, a solution like BRIA is an obvious solution. Another potential example is pandemic tracking. Maybe you can imagine a pandemic. Recently, all countries tried to track, develop some apps to track patient, to track the disease. If it would be possible to validate the results from all the different HMOs, hospitals, clinics, without even exposing patient identity, but able and for sure without centralizing all this data in one database, it could be great, and this is exactly the power of BRIA. That's all. Thank you so much. I'm open for questions, but by the way, if you're interested to continue the conversation, discuss the subject, you're also welcome to write me my email, david@bria.com.
Yeah, thanks a lot, David. Are there questions from the audience?
Yeah, thank you very much. I have a question to your data input, where you say like we have basically a gate or something that you extract the data that you don't ask for standardization on the customer side, so to say, or the node side. And so, for which kind of data spaces in the medical area have you done that already? Because that data space is enormously enlarging. That's one thing, not only within each data space, but even the data spaces. And within these, even the societies that are responsible for these data, let's say imaging, radiologists, etc., are not even agreeing on any kind of standards and quality criteria. So you as a startup, how can you actually manage that huge task that you say, I make the rules now, which one should go in there? For me, that looks like an enormous task.
So the reason I didn't elaborate on this before, because this is exactly the non-blockchain part of the system. However, so here we also leveraged FHIR, first of all. It's the first time FHIR was introduced 4 years ago, and it was the first time that there was some standard for healthcare data. And not only that it is a standard, and in the fields where it's introduced, it may work, it's also a community standard. So it's relatively easy to extend it. For example, we went into the oncological space, and we found out that there are no relevant FHIR formats. So we developed, based on FHIR best practices, our own format, and currently we're suggesting it back to the community. And that's the advantage of such approach. So that's the reason, like Mediblock, we also went with FHIR. One thing that it helped with, before the standardization, was a many-to-many problem. You needed to translate from many formats to many formats, and that's nearly infinite challenge. Thanks to this approach with FHIR, we able to turn this challenge to many-to-one. It's still a big challenge, but it's a feasible challenge. And we do not require from the hospitals to be FHIR ready. Most of BRIA is actually a transformation system, a system of adapters that translates different types of data to FHIR. And we developed a lot of optimizations on this. So today we support already most of the clinical data. We support a lot of imaging data, pathological data, oncological data. So we are already pretty wide.
Okay, Thomas. And please try to be...
You convincingly demonstrated that decentralization probably will help in many situations. However, there are situations where many are faced with in this community where I think it can be of no help, and that is my question. And it expands, my question expands on the topic which Joachim already brought up. My example is rare diseases. We are talking about genetics, and rare diseases is an important topic there. And the question is, the problem is, what is a rare disease? And how to communicate that? Okay, it needs a control, at least a controlled vocabulary. There is none. Better would be to have a terminology. And even better would be to have a full-blown nosology. There are some around. And unless you don't have that, I can't see how decentralization can help with communication. The example is, the European community now is pushing, quite concretely, to use author codes for rare diseases, at least in the clinical context, not in the ambulatory context, because there is a lot of reluctance against that. But anyway, the ministry pushes it, and the law has been changed, and it is written down in the paragraph of the Sozialgesetz.
You also have to give him the chance to answer your question.
Yeah, and that is on the way. However, there is no way, or at least I can't see a way, to map, say, the often used OMIM codification to the ARPANET codification. And if it comes to rare diseases, what would be your answer to that problem?
So first of all, I'm not religious about blockchain. Maybe it's not the solution here, but I'm not sure. Maybe it is, because first of all, because it's a rare disease, the need in real world evidence is higher, as I see it, at least. The need in data is higher, and trying to consolidate data from so many sources, actually I think that maybe in rare disease, actually it's even more needed, because taking data from, I don't know, hundreds of hospitals, it's harder, and preparing everything in advance, it will take tremendous amount of time, while if you just install a connector in every hospital, and then run a query, and then even the discovery of the relevant data will already happen in a decentralized manner. Later you can even, after you discover that, you can maybe centralize it. But at least for the discovery, it may be great. That's how I see it, but I would like to discuss it furtherly.
At the end, do you agree? At the end, it needs some top-down regulation.
By the way, we are completely aligned with top-down regulations. Even our blockchain is a quorum, by the way. So it's a private Ethereum network. So it's not, we don't really leverage the publicity of blockchain. We mainly use blockchain just to manage the system in a decentralized way, where each hospital can control its own data, and to enforce top-down regulations like GDPR and others. So actually we're very aligned with regulations. We are, in blockchain terms, we're much more of a DAO than underground blockchain.
Okay, thanks a lot. Quick question, short answer. You mentioned that you are aiming to reduce the costs by a factor of 10. What would you be able to do with lower costs that you are not able to do right now?
So one of the main things that we see, at least for now, that's reducing the cost dramatically, it's the shorter time to data. The fact that it takes us about a couple of weeks to integrate with a hospital instead of preparation of data that usually take months to years. That reduces dramatically the cost both for the hospitals, for the research institutes, and all of them.
Okay, thanks a lot. And David will also be a member of the panel discussion later on. So post the questions that couldn't be answered in the online portal, and we will get back to them later on. Thanks again.
Thank you so much.
Okay, now I hand over to you, Hartmut. I already mentioned your contribution to the talk at last AGD about swarm learning, and I think you will also give us a little bit more insight into the technology today.
Yes, absolutely. Let me open this up. It works? No? There we go. What's the problem here? No. There we go. Let me welcome you. My name is Hartmut Schultze. I would like to talk about security in medical data. I'm from Hewlett-Packard Enterprise, so a tech company. And like David was just mentioning, a lot of these things might look familiar to you as well, what I'm just showing here. So let me go into the data portion first, because when we really talk about data, we have a lot of data sources. So everything what you see here on the right side is basically a data source. And especially when I look at this audience here, you're all researchers, and you work with data, right? Potentially you do not have enough data to work on in the first place, like we heard before. So it's always nice to have more, and potentially, of course, the analysis as such is too expensive for a lot of data, but if we really want to get insights into that data, we need a lot of data. So looking at the right side, imaging would be something in systems medicines, because we have this multimodal and multidimensional. And just an example, there was a study at MIT in 2019 with 90,000 mammograms. And that was in a research setting, which is of course nice. And they collected all this data, and they could figure out patterns in that data which was too subtle for the human eye. So for the proposition in the future, we will have data spaces which are too large to be analyzed with our current means. So we basically need any type of additional algorithms to actually go for that. Also, like we heard this morning, in omics data, we have data spaces where we're just looking into in very small portions, but if we combine those two, or if we could combine those two, then of course we're better. Again, with wearables, there's a lot of vital signs out there. We have these devices which we're potentially walking around with, and they're collected by large companies as of today, but we do not have access to them. Nevertheless, the physical location, we were just talking about this, is the physical location of medical data is always spread out. It is definitely decentralized or distributed, and not within only one jurisdiction, in many jurisdictions. So this is around the world, and we have to respect also the legal requirements which are imposed by each of those jurisdictions. So coming to data privacy, of course, as we heard from a blockchain perspective, yes, we would be liking to be self-sovereign on something like that. But can everybody do that? I would question that. Because it's good to have hospitals who might be the data custodians for, or your doctor to be the custodian for yourself and your data. It's not yourself, or not every patient around this world would be able to take this in its own hands. So self-sovereignty is, well, we have to take care about also some people. And of course, if we have elder people or younger people who might not be educated or not be capable of doing something like that. So we have to respect that. So there's one thing here which is raw medical data. And I would like to really explicitly go onto this, because data as such does not have any inherent value. Analyzed data does. So if there's no analytics on top of raw data, it's useless. It's just a data pool, and if we exchange data, and that's another thing, if we start to exchange data, we lose sovereignty of this data. We cannot control it after it is once copied. So this is about data privacy and raw data. So all these aspects we have in here. Nevertheless, machine learning, as we saw it this morning, it's extremely important that we apply such methodologies of, well, having the possibility to access these data spaces. And with that, to generate information out of it. And only if some doctors have the information of such large data spaces, only then we can create the knowledge what we're actually striving for. So have a lot of data on the right side, respecting the physical location, respecting regulations, respecting privacy, going into new technologies on how to apply this, and in large data spaces, AI, ML is the way to go. And I'd rather go for ML, not AI, because AI is not existing as of today. We use statistical methods most of the time, so it's machine learning. We heard about this. If we go into precision medicine to really look into the details and applying, here again it's trusted AI, but I basically mean ML, in high content data and high resolution data, which lives at the edge, we have this potential where we need to look into is trustworthiness of such AI systems. And how can we be trustworthy? Because trust is nothing we can generate. Trust is something which is earned. And we need to find a way to apply this directly so that we come away from a bias which is there. We as humans have biases, so it's just normal to have biases. But how can we reduce bias in data which is in there? And that, of course, comes with regions. So some of these regions, some of the regions like the Western states, they have the resources to actually do this. The wealthy have the resources to do that. But of course, if we looked into ethnics, then of course we need to deploy such technology also in different regions. So we will always have a certain bias in that. Nevertheless, can we explain what happens with it? So applying ML models like deep learning models, it's typically a black box system, and we have to take care that we find out which features actually led to the result where we generate information out of it. So coming to that, we need to go into a direction where we can actually trust that. Having fair principles, have explainable, be compliant, be responsible. Like, for example, the legislation in the European Union is currently having a proposal out there. The states are discussing this. Our politicians, so I lately was just talking with members of the parliament on exactly that topic, is how we do this regulation within the systems and how do we actually apply this. So we have a regulatory oversight of this as well. So privacy enabled, it needs to be secured, the design has to be as such that we can synthesize this. It needs to be human focused. The human needs to be on the loop, not within the loop, or not only within the loop, but on the loop. So he needs to decide, in medical at least. So the doctor has to decide. We need to understand it, we need to trust it, and we need to be inclusive. There's one simple thing down here, which is robustness. Robust, so any kind of algorithms need to be robust, again, so that the analysis of such data is going to help us. But nevertheless, it's going to be the data foundation, and there's this quality also. We need to have the right quality within the data. So it's a whole lot of things where we can actually go for. Now let me just briefly go into different aspects of machine learning. So what we typically do, and pretty much everybody of you probably does that, is a local learning. So when you have an idea, you put together a certain data space you have access to, and you do a local learning, which is typically completely independent of everybody else. So here depicted in 3 locations, so you have some kind of data which needs to be shielded because it's potentially yours from a sovereignty perspective. Issue is you have a limited data set. There's a bias in there. There's definitely a bias. You cannot do anything because you don't have the access to a large data space. And potentially it's a low accuracy because your data set is just too small. And it's disconnected. We heard that the other thing, which is central learning. So push everything together in a central place like any kind of cloud, where you then do the consolidation of that data. The thing is, though, you have a large data set, which is good. The accuracy is better. The issue is, do you have access to the data? Can you really agree on the common grounds between different parties who actually contribute to that? As I said, this example with the 90,000 mammograms, that works in certain types of situations, but it potentially takes about 3-4 years to get this data together to actually do something like that. So it's always the balance, what is the benefit out of that? And then if you have a new idea, you as researchers, I would say, you do not necessarily need to scale it into the future, but you need to find the best method and the most easy access to such data spaces. Data privacy is a topic, and also data movement. Just think of this, the overall energy consumption of just putting and transforming and transporting data is about 1/3 of the overall energy spent in the whole system. So 1/3 is within the network, just transferring bits. The other thing, 2/3 is in the systems, within data centers, etc. So if we decrease data movement, so bring the analysis directly to the edge is also a thing. Also, what we heard before, data sovereignty is a topic which is to be considered, because as soon as you give it out, you lose your sovereignty of the data. There's no way around. Federated learning. Some people in the group here have heard about federated learning? Maybe, yeah, perfect. So federated learning does the following thing: brings the algorithm to the data, calculates locally, but the most implementations of federated learning do actually a consolidation in a central server. So this central server, with bringing the algorithms to the local data, has also an issue of, do we have the right separation between central and local? And the issue here is we have a central aggregation and a central custodian. There's no way around it right now. So what does Swarm does? Swarm, that's why I say share without sharing, is you basically do the federated learning or do a local learning and do a meta-analysis on top of that using blockchain technologies. That's the first time I now use blockchain, because it's basically a tool within the system, a distributed ledger technology, which brings me the immutability of the transaction, which is locked between the parties. And why do we do that? We eliminate the central custodian. That's the only reason for that. What we can do with it, it's no data movement, no data duplication, no central custodian, so we have equal parties. Every of these parties has equal rights. We keep the privacy because it's never going to be moved to another party, so it's always in the sovereign space of the data owner. Here in this case, again, I say the data owner in a typical situation would be an institute, like here, a university, a hospital. It's always then decentral, and we keep and we share the insights only. So share the information, which is basically sharing the parameters out of that. So linking such data in multi-dimensional spaces. How do we do that? It's electronic health records, which is only one dimension. Then other parameters from laboratories, from MRIs, from omics, from wearables. So that's the data source. That's the private data source, typically, and then only we put it into local data lakes. And this should typically be in a hospital. So this is decentral, definitely decentral. And we heard about a couple of things. How do we get the right data spaces or the right data in there? How do we do the standardization on top of that data? Metadata is extremely important to actually find the newest ideas, but not the underlying raw data in a large space potentially. Then harmonization, transformation, everything of this needs to be done locally, because there the same principle applies. If I put it centrally somewhere, I lose the sovereignty on top of that. This data is then fed locally in a so-called trusted execution environment. A trusted execution environment does on a system level the encapsulation in an enclave, so that only this calculation can really be done locally on the private, potentially private data. Here, you potentially heard about this is differential privacy, which is a bit of an obfuscation of the local raw data. Because since you can do it, you potentially lose a little bit of accuracy on top of the AI model, but nevertheless, you do a certain type of de-identification with that. You also can apply any kind of synthetic data at the local data space here. And you see the two vertical lines. These are basically firewalls. And that's the security also. It's a technical security which needs to be deployed at the source and then into the network. And the network as such is then smart contract based and also what we heard of private permissioned. It's a consortia database, not a public database. And that's for a very much reason. It's also about the sustainability, because we believe that there's always an agreement before in a consortium to generate the trust who actually want to work together to find a way to solve a problem. And that's why we do not need a complete decentralization or a public blockchain. And especially, like Wolfgang was mentioning before, we have these different layers of blockchain. So we could use this again and then validate it into to another public blockchain to see, okay, that the private blockchain is actually then trustworthy. You probably have heard of the Nature paper we released last year, made it here on cover of Nature. And here there were 127 clinical studies pushed together, so a large data set. We had something like 50,000 runs, did it on leukemias, tuberculosis, COVID-19, and also on X-ray images. So I'm not a doctor, I'm an engineer actually. So basically the data space as such is only data for me. it's not, I do not know what the content is. Nevertheless, we know how we can do the orchestration underneath. So does it actually work? What you see here on this picture is the test accuracies of the different nodes, so 1 to 32. Swarm was always better than the local nodes. That's what we saw throughout something like 50,000 runs. There was a nice paper just released this year. They did it in a federated space. And they said, okay, we take an off-the-shelf or off-the-street model, applied it to a lot of data, and they increased the accuracy by 30%. So basically what this is saying, if I have a local model, I'm typically less good than I have a large data set. Now you could say, okay, maybe I can push everything into a central model. That's basically what a colleague of the Barcelona Supercomputing Center asked me once. And I was saying, well, this is the wrong question, because you will never, ever be able to consolidate all the data into one space, because there's some reasons why not to do it. So agree upfront on top of that. Robustness. Continuous learning. What we did also is we took some, let's say, bad training nodes, which had a loss function here, which is then only a convergent in later epochs. We took some other good nodes and then we pushed them together. What this showed us is that throughout the epochs, even if I lose connection between decentralized systems here, I can even train and re-onboard or reconnect again, and then I start on training with them together. The 6 nodes combined led to the situation that they were as good, or the bad nodes were as good as the good nodes. So this is resilient in that way. In another study by colleagues from RWTH Aachen, and that's why I like this picture so much, now you see here there's a split between the clinical data, which is locally, then we have the AI process, which is locally, and then we have the network process on top. And the network process is basically the orchestration and the aggregation in this meta type of learning. So what they showed is exactly the same. What we showed also in a different data space, it performs better than local, on par with central, if you were able to push all the data together, but it does not require the institutions to get relief of their sovereignty and the custodianship of the data for the final model. So how does it actually work? You register to a network, the private permission blockchain. Then you train the nodes locally for this training epoch. The parameters are pushed together, merged at a specific node, which is then by randomness, and then you just do it again. Even if one of those nodes fail, it doesn't matter, another is selected for doing the aggregation. Also, this helps to reduce the attack surface, because you won't have a central custodian, a central node, even if the workload by its such is certified and secured. So this means, and you can look at and download it in a community version of Swarm Learning and use it by yourself in your setting, and it enables the equal and like-minded partners in a network. So you can try it exactly right now for higher resiliency. So from a stack perspective, we don't care about where it actually lives. It can live local, it can live in the cloud, but it should be there where the data is generated. And typically it's in the custodianship with the one organizational organization. So it's within the entity. And then here we have an Ethereum private permission blockchain also included, but that's under the hood. You don't have to take care about the blockchain part of that. And then you only work with models. So you do the model and in the integration. For the sake of time, I skipped this one. So what I would like to say is we can integrate any kind of private data anywhere in the world. So you define the problem, you do the integration. It's a simple swarm callback on TensorFlow or Keras TensorFlow or PyTorch. And then there's a callback, which is basically the orchestration, this network process underneath. Now let me come to blockchain. So why is blockchain so important within here? It's the immutability, like Wolfgang was saying, like David was saying, like TJ was saying. It's the immutability that you can actually track what is happening. So from, I'm also within this for a couple of years now. So from the hype cycle, this is the Gartner hype cycle, you see these emerging technologies, and you see it's also on through the valley of disillusionment already in 2018, because it's complicated. Why do I need it? So this progresses, and you see blockchain is now pretty much at the down there. Digital assets, cryptocurrencies are picking up. Now we have smart contracts. Yeah, do we need it? How do we do it? What do we put on the blockchain? Yes or no? And now this, you see, Web3, what was mentioned before, we go into this direction. But it's always the same thing. It's about centralization or decentralization. And now let me put you to one thing. We had this before. It's a database versus a blockchain. Why do I need a blockchain? So there's different attributes to that. So security, its access is read and write, like we heard before. I can do a lot of things with classical tools. I do not necessarily need a blockchain. You see, from a traditional database system to a permissionless blockchain shared system. And I liked your use case canvas because, well, this is decentralized, centralized, because that is pretty much the simple model for the whole thing. And this is something I would like to point you to extremely important, because you can have a simple, before you go to Wolfgang and discuss the real use case, you can potentially say, do I need to store state? If there's no necessity to that, don't use blockchain. Don't even think about it. Do you have multiple writers? If not, don't use it. Use a database. Use whatever, any kind of NoSQL database. Do you need a trusted third party within your process? If no, don't use blockchain. Just don't do it, because it's just a hassle. It's just too much work to do it. Do you know all your writers? If you don't know them all, then you should use the public blockchain. If you want to know them all, or want to really have control about the system, then you should be looking into a permissioned blockchain, either private or public permissioned. But then it's, again, in a consortium. And it's this very important tree where you can always think, do I need a blockchain project? What we figured, and that's why we use a private permission blockchain, it's very valid to have a blockchain underneath because of this one attribute, which is immutability. And with that, I'm open for questions.
Yeah, thanks a lot. Very educative last slide, so I think we will need it again for the discussion later on. Are there questions in the audience? Fabio, can someone pass the mic to Fabio?
Thank you for the very interesting talk. I have one question, because you stated that the infrastructure that you basically provided, or the host, more or less. My question there, because the machine learning models tend to become bigger and bigger, and so you need more computational power to execute them, and also the memory to even store them locally. Do you have some kind of contract then that you regularly increase the performance of those computational centers, or how do you want to provide the information also to the machine learning scientists who want to deploy those models, how much memory is available, so what kind of models they can run there?
Yeah. Very good question. You basically, what the important thing is, any kind of model you're trying to reach depends on the data space. So now you can think of this decentralized data space as just a large supercomputer spread out, because it's a peer-to-peer system and you just distribute all your resources. So basically, you know SETI, potentially, it's the similar thing. What we put into there is the peer-to-peer orchestration and communication for actually the different epochs. So potentially in a distributed system, it takes a bit longer, but the computation power is pretty much the same. But it's only limited to what you're actually trying to reach. So when we were talking this morning about a genome, for example, 50 to 70 gigabytes, and you have this multiplied by 100,000, if you spread it out, it's not that large. That doesn't, well, if you really think in supercomputers, it's not so much. It's doable. It's a lot of effort, no question about that, but it's doable. So if you have these large models like GPT-3 or something like that, that is, of course, because this huge data space. But of course, this could be decentralized as well. It's more effort, though. Why we come from a decentralization is, of course, the custodianship you need to do, this trust boundary or the entity. Might it be regional, might it be local from a hospital perspective, where you can actually not traverse this. And that's why we do it decentralized. If you can do something, it's the same thing with a blockchain. Sometimes you shouldn't be using it. And in a certain setting, if you start locally, test what you have, and then you have the impression, okay, I did the right quality measures, I did the right harmonization on my local implementation. Then you have the freedom now to spread it out. You find the right partners, you apply the same pipelines to the local data, and then you actually get the results, which are then better.
Okay, thanks a lot. So Hartmut is also part of the panel tonight, so I would suggest that we move on to the last talk. So thanks again.
Thank you.
The last talk in this session is by Anna Graf, and now we are very curious where art is in the type cycle. Are we in the Valley of Depression? Well, let's see.
Am I in the right presentation? No, I'm not.
Das ist nicht deine, oder?
Nee. Just a second. But let me start with, I changed the title a little bit already because it was like NFTs democratize the art world. Well, that was our goal. I changed it to art decentralizing because, as we already heard, blockchain is not always the solution, and blockchain sometimes is not as decentralized as it seems. So it's still interesting to see what happened last year and this year, that suddenly ideas that were already, yeah?
You have to help me. Is it in this folder?
I would say my name is something with AGD, but I don't know where it is. I sent it to you. I asked you. You said you received it. You know? Otherwise, I hope you can connect my phone.
Yeah,
That would be great too. You know what? This is so funny because I was at the Demexco, which is also like a fair in Cologne last week, and I came 20 minutes early, and they didn't have the right presentation there as well. So it seems kind of bad luck right now that the presentation is not here yet. But anyway, I have been speaking a lot, so let me introduce myself first. My name is Anna Graf, and I entered this space, the NFT Web3 world, through the art world. So this is how we come to the title. And there we go. You are prepared. It's great. Because sometimes it's nicer with some pictures additionally. Or we do the Steve Jobs, but at least one picture should be there. Sometimes it's nice just to work around. Sometimes it's nice to know some pictures. So, thank you so much. Is the clicker also working? Probably not, but then I use this here.
It should. It actually should.
Yeah. So, okay, the title I already talked about. This is me right now. You find me on LinkedIn. I kind of like to share all my stories on socials as well, so that you follow my journey maybe, because the journey basically says what the space has been evolving like in the last 2 years. And now I'm Innovation Lead Web3, as Peter said, at a very big enterprise that is Avato Systems for Bertelsmann. What?
I will just...
Is this normal that you hear yourself all the
no,
time here?
that's what I try to change.
Okay. I know you're all
we
hungry
are caught
probably.
In the loop.
Yeah, you're all hungry probably. And I want to, yes, as I said, I'm working for Bertelsmann, and many people might not know this company. Who of you knows Bertelsmann? Please raise your hand. Yeah, you're all hungry. Okay, you all do this. This is super great because often I say like, okay, what's this? Is it maybe about books? Do you think of books when you think of Bertelsmann? Okay, I will change this in a minute. Yeah, this is, we talk about Web3, but most of the time even Web2 is not working. So, and then it comes back to what is the hardware doing right now with my great presentation. Okay, yeah, who of you knows the RTL group? Please raise your hand. Okay, great. Michelle Obama's book, Becoming. Anyone read that one? Well, yeah, okay. Now Tina Turner. Yeah, okay, yeah, great. And now the last picture, this is the airport in Hamburg. Has anyone been there? Great, okay. A few at least. It's a beautiful town. I live there, I work there. And what do they all have in common? These are all parts of Bertelsmann. So just a quick overview of what we do here. We're very strong with media. We have some employees worldwide. It's over 140,000. We do services, education, investments, and you will find me at Avato Systems. So I am in the IT services sector, which makes me very proud because I feel kind of nerdy, not being in the medical space, but at least I made it to the IT sector. And yeah, we help our partners to do the digital transformation. And that's why they hired me this year as the Innovation Lead Web3, because we see that there's something going on and that we really want to be the ones who help others to get into the space. And if you look what we are doing, there's even healthcare and pharma. And also, as I said, media, public, consumer goods. So a lot of things we look into, and we see that there are opportunities when we do Web3 and help our customers get there as well. We were talking about pictures from apes, CryptoPunks, etc. But there's so much more, and as we've already heard from the former speakers, which was amazingly great to listen to all these things and how much people are developing, we are also looking into different fields right here. Me, myself, at the moment, I'm working a lot with the loyalty programs and the digital assets, and you will see why that is. But if you look here at the list, there's so much you can do, from trading of CO2 token to AdTech, which is our media stuff, of course, and digital patient files, decentralized patient data, and of course digital identity, which is one of my favorite topics because there are so many different layers to it, from owning an ape and making it your profile picture to really having some security when you go on websites. Why is this all happening now? Because 2016, most of the ideas already existed. We already had Ethereum. Wolfgang gave us a great overview also back to the tally stick, which I will definitely post on LinkedIn, by the way, because it was great to understand what consensus means. And yeah, here we have my personal 2021. Does anyone own an NFT here? Raise your hands if you... Okay, well, to be honest, that's better than at the code talks, where we had a lot of coders, but none of them owned an NFT. And I think we have to convince here still to get one. So we will see. But this is basically, it was a time last year. The main word was like FOMO, fear of missing out. And you always try to make a lot of money. The main question that I was asked was like, how can I make 10x? And myself, for me, that was not really what I wanted to look into, because I see that there's so much more, as we've already heard, and not only in the health sector, but things that have already been done. And here I started this project with Alicia Quade. She's a very popular artist from Berlin, with her project that I wanted to show you, because she basically had her whole genome sequenced. And there was this lovely exhibition in Berlin. So basically here you see in the background there are printed pages. So that's a whole genome, 14,000 pages on the wall, and the rest was in those cover boxes that you see on the bottom. It was around 300,000 pages. So this exhibition was lovely. I think I visited it like 10 times at least, because it was just amazing to see this and to realize what identity means and how you can transform it into an art exhibition. But every exhibition ends at some point. And so we were wondering, how can we really transform this into something that will last like forever? So the blockchain was the thing that we all looked into, because blockchain is supposed to be forever. So why not do something that really, for one, helps this project to survive and last longer. Number two, make the art that is very, very expensive, to be honest. So owning an Alicia Quade, lucky you. But this art accessible to everybody. And number 3, really do something that shows the power of Web3. So we minted all these pages in a sequence of 25, because 25 basically is one gene, I was told, on the blockchain, and made it available for a price of around 200 euros. So you can own this. Additionally, you can print these pages and have them hung on the wall, so that you really own a piece of art by the artist, and not only a piece of art, but a piece of her DNA. And when you look at this picture, this is why it's about identity. You see that there are some letters in bold, and these letters are the only ones that are like differentiating, you know this a lot better than me, from the general genome of everybody. So it shows that we are kind of equal, and this is her topic. So this was a project that I still really, really love, because it made sense, it is art, and it was not to be there to be just an investment and get to a high price in a certain amount of time. Now looking into other use cases, I love this one as well. It is American Idol. Does any one of you know the show now that I show you this picture? It is the German Deutschland sucht den Superstar. And they collaborated with Theta. Theta is also a blockchain to create an NFT that really shows fandom. And this is also a great use case when you look into utilities. And coming back to why this might be interesting for the medical sector, by the way, you have to incentivize the consumer in the end to, for example, share their data if it's decentralized and if it's in their wallet. Why should they share the data, except they have some disease that is really bad? But how can you incentivize people to do this? And yeah, giving some utility is a great example. And you see this here. For American Idol, you can vote. There are like many, many singers, and then you vote. And if they go on the top 10, then they will go to the next round. And you could kind of bet with the NFT on these singers. So you could buy, for example, the NFT of Billy, and if Billy entered round number 2, you would get extra rewards. And in the end, there is this, you see this golden ticket that you could win. So if you got from week to week, every stage, every next stage, you were incentivized that your NFT that was very, very cheap at the beginning became more and more valuable. And this is kind of put together how it went. They were not really expecting people to trade this. But what we realized is that there now is a community that really started to love the product. And additionally, it was possible to get more people into the space. Because on one side, we had the fans that bought the NFT because they wanted to own and share a part of their singer, of their favorite singer. On the other side, we had people that belonged to the NFT community and that saw that this is a valuable product because it combines fandom with rewards, and there's an intrinsic value to it. And this is why it's very interesting for me if we look into like music for BMG or publishing as well. When you have somebody that you really admire, how can you become part of this whole thing? And this is what 3 enables us to do. Another project that I did when I moved from the gallery that was in Berlin to Hamburg, I'm always very spontaneous, and if I want to inspire, I also want to tell you, just check and try and test things. This is always the easiest way. I'm sure that you already do this. You know, trial and error from your fields, and it's the same when you get into NFT space. There are a lot of people who just talk about it, but for me, it's more important to make it accessible and also have the experience of what it can do and what it really means to own one. So we did a treasure hunt. A treasure hunt for Web3 with a POAP. POAP means proof of attendance protocol. So it means that you prove that you were there, and for this you get a little badge as a reward. This is the Harbor birthday. Looks very fancy. It wasn't this fancy 2 weeks ago, to be honest, because it was raining a lot, but this is a very nice picture to give you an impression of what we hoped for, maybe in May. In May you can join us again, and I hope that then we will be official partners for this. Yeah, this was interesting because it was kind of what Web3 means, a community of people who come from very, very different spaces. We had people from a branding agency, we had me as a kind of IT girl there who was organizing the whole stuff, and we also were lucky to have the Hanseatic Blockchain Institute, which is connected to the politicians, so that was a good mix of people who could really achieve things in a very short amount of time. And when you talk about NFTs, what I've realized is that nobody's interested in what an NFT is, because it's a technology basically. And if you really want to go to the mass market, then it's not necessary to know what an NFT is, but to know how does this product help me, or how does this product enhance my life. And in this case, doing a treasure hunt where you could just walk around, you see this here, we had different stations with QR codes, and every time you found one of these QR codes, you could scan it. You just needed your email, and then it would automatically create a wallet for you in the background, so you wouldn't have to do anything else, but just go there, and then you had your POAP. And if you collected 4 out of 5, you were rewarded with a special golden one. And this, of course, is a nice thing, but if you think economically, it is also something else that is happening there, and that also happened with Theta. You create a new token-gated community. And from there, we can start now with, for example, creating merch that is only accessible for people who own this golden token. And there comes the interesting part. We will also think about loyalty programs, incentivizing, and making people really connect with the product. Now, I think I have a few minutes left. I will hurry. What is the next step? As I said, 2021 was kind of the year of the NFTs, and 2022, if you look into the media and what brands are doing, it's always about the metaverse. The metaverse is kind of, there are many definitions. It can be a virtual place. It can be a time. Some define it as a time when you spend more than 50% of your real life in front of a screen. Then where are you? Where is it more important to look great on the screen or in reality? And these are all questions, and you see that it's kind of evolving, I would say, and that there are many different parts between reality and virtual reality. And I think for the medical sector, this is very interesting because if you look at all the places where healthcare is not really available, but people still own a computer or a phone, it is the easiest way to access them. And especially AR is getting more and more into reality through filters on Snapchat or Instagram. And from there we move on until we enter the space of virtual reality, which is still kind of a hurdle, because for myself, using these goggles, it feels kind of, I always get dizzy. Still, of course, it's a great experience to be in a virtual space with other people, and I hope there will be some improvements very soon. To make one thing clear when we talk about definitions is that Web3 is not the metaverse. So if you're looking into the metaverse, as described here, there are some points that apply to this, but Web3 basically can be part of a metaverse, but it's definitely not part of every metaverse. So this is also interesting if we raise the question, does everything have to be on a blockchain? Certainly not. And for you, if you want to build in the space, if you want to do things, you can totally decide, okay, I want to be more on the left side, or I want to integrate NFTs, digital currencies, digital identity, or I just leave all of this behind. Nonetheless, looking at the numbers of what is happening right now, because this is always interesting when you work at a company, and I'm sure that you also have to do this, it's always important to see some numbers. And very interesting when we talk about metaverse is Roblox. Anyone of you has played Roblox? Okay, I will show a picture later because this is kind of the thing. It has 55 million unique users every day. and is kind of the biggest virtual world that we know at the moment. And yeah, the trading volume of NFTs, it's more like from 2021 that has gone down, but still the sales in the metaverse are reaching more and more of an all-time high. This is interesting maybe if you look into these Web3 metaverses, which I do not really like the experience of most of them, but still, and the next number is very interesting, Meta has invested a lot into hardware so that this virtual reality might become a true thing maybe in a few years. Yeah, tomorrow we are hoping for interoperability, of course, between these worlds, and we will see what of the things will be happening, because we can never foresee the future, and maybe other things will come up that we do not even think of. So, I mean, you are the ones who create in the space, so this is very important that you find your ideas and find the right solutions for problems that already exist, instead of finding problems that have not existed before, because this is what I see very often in the space where I think, yeah, okay, nobody needs it, and maybe it's an investment tool, but nothing else. Looking into a few different metaverses now, we see that, of course, Microsoft, Epic Games, and Meta, you know. For me, one of the hidden players that will play a very important role is Google, because they kind of have all the pictures of the whole world, and I think that everyone here in this room has already used Google Maps. And coming from there, you might kind of feel that if you enhance this, especially with glasses, you might find a totally new world when you add layers and see the world just in a different perspective. And in the industry, this is already happening, also for medicine, of course. And I think if this can be improved, and they're working on this, this will be kind of a revolution in this evolutionary process that we are already in. For this picture, I think nobody of you has seen it yet. This is very interesting because it combines AI with the idea of a metaverse, and is done by an artist. His name is Refik Anadol. It's very interesting because his father is, I think he has Alzheimer's disease, and he's experimenting with sounds and pictures, combining them with AI to really create worlds, animated worlds that soothe you in a way. And if you have ever had the chance to see one of his really epic installations, it was amazing. I was in this gallery, I was sitting there, everyone was so quiet, and people were queuing for 4 hours to see this artwork that was on 10 times 10 meters, and it was just amazing. And yeah, maybe you can check him out on the internet, Refik Anadol. And yeah, last but not least, I want to come back to the two different virtual worlds that we can now look into, and where brands are really entering the space. This is a cute one because it is a German brand. It is called Kaufland. Maybe you have already been shopping there. And it was very kind of wow, they are entering the metaverse. The game is called Animal Crossing, and they did an educational project there. So what they do is they have this little farm there. It's very cute. It is called Kauf Island. And you can play. And if we look into loyalty programs, it would, of course, be interesting to see how can people be incentivized going to the point of sale, and then maybe getting rewarded with something that they can use in this game in the metaverse. Same thing goes for Nikeland on Roblox. Roblox basically is a platform where you can play a lot of different games. And you will find Gucci Town, you will find Walmart now, you will find Nikeland. Even Deutsche Telekom has its own world there. It's called Beatland, I think. So it basically is played by Gen Z, so under 25, I would say. And the interesting part here is that it's 70% female players, which is kind of revolutionary and nobody talks about, but it really shows us that the future also of gaming and metaverse is very female. And for me, working in the IT space, this is kind of an interesting learning. Has any one of you seen this project, other side already? Please raise your hand. Yeah, okay. This is, we saw the apes, Wolfgang showed us the apes that were so, like, they were like around $200 at the beginning, and now you get one for around $100,000. And everyone wanted to, you said ape into this. And if you didn't own an ape, you at least had the chance to get one piece of this metaverse land. This is not really even established, but this world is supposed to be interoperable, to be like the real Web3 stuff. And we will see where it goes. There has been some testing that looked already quite nice, but developing a metaverse, I think that will take a few years. So, and last but not least, Starbucks. Some of you might have heard of this one. It is called Odyssey, and you can now be rewarded with NFTs and they promise immersive experience in their own world. They're creating their own platform. And the interesting part about this one is also like Theta, you start at a very low price or even enter for free. And the more you interact with the brand, the more value your NFT will get. So the creator is rewarded every time that they do something, whether it's on social media or in store. And this is combining, again, the idea of virtual space and real world. And I think I made it on time, except for the beginning. So yeah, I hope this was a little journey that you didn't know about before. If you want to connect, feel free to add me on LinkedIn. If you have any questions now, feel free to ask, and then we can have dinner before the panel. Thank you so much.
Yeah, Joachim.
Oh, great. Joachim brought me here, by the way, so I'm very grateful. So please ask your question.
Exactly, that's why I'm going to challenge you.
Oh, yeah.
Because, you know, of course, medicine might be a conservative area of our life. And these things usually start somewhere else. But you also showed that your company is in healthcare. Mm-hmm. I would have two short questions. The first one is, how does Arvato Bertelsmann think to use blockchain in the health sector? You know, what is your idea? Not necessarily what you think you bring yourself, but how you watch the field. What is, from your perspective, priority number 1 or 2 or 3? And the second part would be, how
shall I answer this first, and then you go with the second part, because it's easier, I think. Of course, since our clients are often in the supply sector, supply chain is one of the most important things. So certificates that you can really track the medicine, this is one part, and also the digital patient file, as I said. We also have another company that is Arvato Financial Systems, now Rivety, and they are looking into the digital identity. And I already said, like, okay, if you really do this product, that will be super interesting for us as well, because we have heard how important it is also for the accessibility of your own data, of owning your data, and then however share it, because this is still an interesting part. We also heard a lot about, like, what if people are too old to own their data, what do we then? So there are a lot of ethical questions that we also look into, of course, and it will be interesting to see how we solve that. Zero proof knowledge is, of course, one thing we are looking into, but then you need some kind of twist if you really have to have access to the data and make it also like compliant, because this is, as Arvato Systems and the brand, it's very important for us to be legally compliant and not get into things that might be regulated in a way. So if we see ourselves as a partner for our customer, that also means that we are a trusted company that will deliver on point and give you the security of being compliant with the things you do, and not just test and try when you deliver it. So this is why we're still in the exploring phase. So now number 2.
Number 2 is metaverse and medicine. Mm-hmm. So you have been more exposed to that, but what is your impression how the medical sector, the science medical sector, might benefit from such a system? What could be an easy entry point?
Yeah,
or is there none?
I think there are many, because look at the insurances that are now getting into the space. Ergo is building their own metaverse, for example. And I think the point, what I also wanted to inspire with, is kind of gamification. Gamification, like the shoes you were talking about, is always something that incentivizes people to do something. So if I have to wait 4 months to go to the doctor to have some checkup, maybe there is a way to make it a little bit easier, more accessible, and as I said, solve a problem instead of creating new ones. And if I have a virtual doctor that, for example, for skin, this is already possible, this is what is happening out there. But now imagine myself being a cute character going there, especially like a younger person or also children. This might play a role, and then you get some reward at the end to really do this. And then you can collect the data afterwards, and this will help everybody. So I'm always looking for the win-win situations in this case.
Thanks a lot. So Anna will also be part of the panel. So I think we close
we
we will close the session now.